This video will demonstrate the use of the quill barb suture wound closure system enclosing the donor site for hair transplantation surgery. First, the strip of skin is being removed. And then the donor site will be closed using this new wound closure system. Undermining is helpful in releasing some of the tension on the skin. The bidirectional wound closure system allows the first suture to be started from the center of the wound, passing to the left side. Notice how the suture locks as soon as the other side is pulled to the same point because the barbs are facing a different direction. Continuation of the placement of the suture from the superior to the inferior wound edge continues until the end of the wound is reached. Notice how the edges are approximated with even distribution of tension along the entire wound edge as opposed to single point fixation. At the end of the incision, the needle is brought out through the hair-bearing scalp. Notice that no knot has to be tied as the tissue has been secured all the way along the length of the wound. The other half begins going from left to right at the same level, closing the right half of the donor site. It's locked in a similar manner. When exerting traction to the right side, it locks because of the way the barb suture is heading on the opposite side. In some cases, this may be the only layer that's required to be closed. In some cases, a second barb suture can be used for further approximation of the wound edges, and that will be demonstrated in this video. Again, the suture continues to the lateralmost aspect of the wound edge, and when the tissues are completely approximated, one last bite will be taken before passing the needle out through the hair-bearing scalp, as was demonstrated on the left side. The needle exits as it had exited on the opposite side. Then the suture is cut close to the skin so that the cut end will retract just beneath the skin. A second suture of a smaller diameter is begun again in the middle of the wound, going to the left side, locking immediately because the direction of the barb is going the opposite way, preventing the suture from being pulled all the way through. Note the approximation of the wound edges even at the epithelial level by placing a second row of sutures. Again, no knots have to be tied, and the tension is evenly distributed along the entire wound edge. The suture demonstrated in this video is an absorbable polydioxone suture which will allow the body to absorb the entire suture within several months. Therefore, there will be no sutures left in place after the first several months. Again, the suture continues at a slightly more superficial level, exiting the left side of the wound through the intact scalp. Finally, the needle exits the scalp and the opposite side is begun, similar to the deep layer closure, but at a more superficial level, using a slightly smaller diameter suture, which is the opposite side of the suture that was just passed. Again, after completing the placement of the barbed suture, when the edge of the wound is reached, the suture is passed through the intact skin.